Many a times, nurses only read or go through the NMC code of conduct, either when something has gone wrong or they want to do revalidation. Do we agree to that? See, your uniform can be removed, your job can be changed, but your PIN is your professional identity. It is more or less like what protects your ability to remain in the profession. So, in this video, I'm going to share with you the importance of the NMC code of conduct and how it is applied in our practice as a nurse. Welcome to my YouTube channel. My name is Funke Aringbangba. I'm a nurse, a clinical educator, a digital health enthusiast and advocate, and I'm going to share with you things and tips on how you can build your career as a nurse within the NHS here in the UK. So let's dive in. The NMC code is not just a guideline, it's a professional standard, right? And it's your legal and ethical accountability system. You are legally and ethically accountable to all the codes of conduct of NMC. So you have to definitely have a good understanding of what this conduct means, what this code means, and how do I apply it into my practice as a nurse. Now, it applies at all times, not just at work, and it applies across all settings. It is used in fitness to practice investigations, right? So when things go wrong, some of the things that the NMC, which is the Nursing Medical Council, looked at is your code of conduct of your actual practice in relation to the NMC code of conduct. If it does tally, if you've practiced outside of that, and if you've done something wrong that is not in alignment to the NMC code of conduct, that is when you've gone against that code, and that is when disciplinary actions then begin to take place. Now let's look at the four pillars of the NMC code of conduct. The first one is prioritize people. What does it exactly mean, and how do I apply this into my profession as a nurse? This is all about dignity, compassion, respect, and advocacy for your patients, right? And even for yourself and your fellow colleagues, right? How do I prioritize people? You have to respect privacy and consent. You have to ensure that before you can do anything with anyone, you gain consent and provide privacy. If it has to do with, dignity, that is of utmost importance. So if peradventure you did something out of the will of that patient and they have capacity, then is you going against the code of conduct about prioritizing people. The next thing is listening to patients. You have to ensure that you engage in active listening. You listen to your patients to ensure that you hear them and you understand, that plea, as compared to just wanting to do whatever it is that you feel you need to do with them, right? Sometimes we are so engrossed with the many to-do work that we have and the workload that we have in our day-to-day practice as a nurse, that we forget that the act of listening is part of what actually brings the awesomeness and healing that we pray for in the life of our patients. Challenging unsafe practice, very important. Part of what prioritizing people would look like is that you would challenge safe practices that are safe. You find that maybe a staff is doing something really wrong to another patient. You want to challenge that practice, right? You want to ask, why are you doing this? You want to escalate it to the right senior team so that things can be dealt with accordingly. Cultural sensitivity. You have to ensure that you have an understanding of cultural differences within your organization and where you're working. You have to know that people in this particular culture might have difficulty in expressing themselves, and that needs to be put into consideration. So you're not being seen as someone that is bullied, or someone that is trying to make the environment unhealthy for other people to thrive in. So very important. So prioritizing people sometimes means speaking up as well. It sometimes means saying things that are wrong and challenging it safely and professionally, right? The second one is practice effectively. Now, what does practice effectively entails? We know that when it comes to practice effectively, here we're talking about competencies, we're talking about communication, and we're talking about collaboration, right? Practicing within competence, very important. And that is why some of the things that I always say, especially to overseas nurses that have come into the country, and back where you've come from, you can take bloods, you know how to put cannula in. Now, all these skills, you have to keep them and put them under yourself until you've had the training here in the UK and you've been signed off within your trust. Because if you do it because you have the basic knowledge from back home and something going wrong, you're going to be in for it, because you are not, covered within the trust to say that you've had the training and that training has covered you to practice. So you must practice within your competence. This is really for the overseas nurses. When you come into the country and you see things that you not naturally would do yourself, for instance, female catheterization, back home, I know how to do it. But coming into the country, I had to ensure that is there any training and competence that I need to have acquired before I can practice it, even though I have the knowledge and I know how to do it before coming into the country. So practice within your competencies is of utmost importance. It keeps you safe. It keeps you secure in your job. Number 2, asking for help. Very important. If you're not sure of what to do, if you feel that it is becoming overwhelming, please ask for help. Don't feel like they're going to say, oh, you don't know what you're doing, you are not competent. It's better for them to say that, laugh at you, than for something to go wrong and your pain becomes a stake and you have to be dragged into the courts, right? So please ask for help. What you don't know, you don't assume you know. Ask, and you would receive the right help. And if not getting help where you've asked for, escalate further to the senior team that you need help, and this is why you need help. Okay. Another is accurate documentation. This is very important. I cannot tell you the number of incidences that has happened as a result of people not documenting things accurately. I have had encounter with friends that has gone through a lot of disciplinary actions just because they didn't document what they had done. What is not documented in nursing practice, it is not done, regardless of how you want to paint it, regardless of how you want to explain it. If you have not documented it, then you have not done it. So please, documentation is very important. And if you're struggling with how to document accurately, reach out to your practice educators. That is why they are there, to teach you, to help you, to guide you. There are some small guide that I did when I was working with a particular ward with some newly qualified overseas nurses, to help them to teach them what to document and how to document, what exactly needs to be in documentation. There are some basic things that must be in your documentation, and it is specific to the kind of diagnosis or the kind of condition your patient has. So if you have patients that have issues with maybe infection control, you have to document if they've passed loose stools. You have to document whether you've sent a loose stool across. You have to document the kind of precautions that you have put in place, where you've put them in the side room, how you've ensured that you decontaminate, all those things have to be, in place, right? If you have, so it all depends on the kind of patient that you have. But there are some very basic mandatory documentation, things like activities of daily living, the kind of food the patient eats, in terms of their dieting, the types of diet, the types of fluid, and that needs to be escalated. If they've got DNA or NERDs, if peradventure their mobility, status, where they live, their feeding, nutritional status, all these things are paramount. Pressure sore areas, if there's any, you have to document it. There are some compulsory documentation that must be in your notes, and you need to identify and find out what those things are. If you're not sure, please reach out. That is why you've got preceptors, that is why you've got practice educators, that is why you've got senior colleagues that can help you and support you in accurate documentation. Also, effective handover, very important. How do you practice effectively? Effective handover. When you're handing over, make sure you're handing over key points and also highlighting key things that the staff needs to know. Because if you don't hand it over and something goes wrong within the period of when the staff has just taken over and have not gotten to what you did not hand over, it's still going to come back to you, despite the fact that it's not on your shift. So it's very important that you highlight every key handovers, every key point that you need to hand over to your team, right? There is an acronym, like a very proper framework that has been designed for handing over. XBAR. If you're not sure about it, then go read about it. If you want me to talk more on it, I will do. XBAR, we have a situation, background, assessment, and the XBAR for recommendation, right? Okay, XBAR. Okay, and then the third one is preserve safety. Preserve safety, very important. This is where many nurses get caught out. Yes, preserve safety. Number one, escalating concerns. How do you escalate? When do you escalate? What do you escalate? Very important. What are the escalation process? And when I'm talking about escalation, I'm not just talking about when a patient is deteriorating. I'm also talking about escalation as a result of having, putting in an unsafe practice or unsafe ward. For instance, you normally would have just 10 patients, and because the nurse has called in sick, rather than for them to get someone else for you to work with you, they actually ask you to begin to take 20 patients, which is definitely unsafe for you. How do you escalate such? Do you know about your date text? How do you input stuff into your date text? I'm going to talk more about date text very soon, because I know a lot of times, one thing I've realized, especially when I was used to work as a bedside nurse as well, we don't really date text enough. Number one, maybe because we refer to that we don't see anything happening with date texting, but it's wrong. You are really wrong. I got to realize realized when I came into practice as an educator that your day techs have a word, is a voice that is speaking. It might not speak immediately, but the more you do it, the more you see that the senior team will bring it together and begin to look into it, right? They have voices. So please detect any unsafe environment that you find yourself, right? Escalate professionally. Talk with your seniors professionally. Don't make it too lackadaistic about it. Don't be too rude about it, right? Because at the end of the day, your patient safety is of utmost importance. But yes, you must escalate. How about escalating deteriorating patient? Very important. The moment you see that your patient's observations are really going bad, you have to escalate. I'm going to be talking to you also about what are the first signs of any early deterioration of the patient, right? We're going to talk more about that. Yeah, just let me know anything you want me to shed more light on, from nursing perspective and career path, and I will be more than happy to share with you, right? So escalate concerns, escalate, deteriorating patients. And how do you escalate? Who do you escalate to? What intervention has come as a result of the escalation? And what do you do when you're not getting the right intervention? Very important. Nurses get caught up in this. Following policies. Oh my goodness. Like I told you in my last previous videos, if you've not watched it, especially the first video I made around, what you need to know as a nurse. Number one thing I said is policy. And I know that when I used to practice as a nurse as well, I really don't think about policies a lot. But when I got into education, I see the need for policy reading. I see the need for knowing about the policy of what you practice so that you can practice safe, right? Knowing what is your own within your own scope of work, scope of employment is in your policy. So policy is very important. Don't go outside of your policy. There are things that you would know or you wouldn't know until you read the policy about whatever practice that you're doing. So don't be see one do one thing. Actually ask in the policy, because the policy is like a guide. It's like your safe zone to what you do and practice within the trust. Once you follow policy and things still go wrong, you are covered because you actually followed policy. But you can't follow the policy you don't know. So it's very important as nurses that you engage with policy. And like I mentioned in my previous video, policies around what you practice is a must read. Policies around med management, IV therapy, pressure ulcers, safe care of the patient, even your own well-being. Go and read about it. Okay, so policies. The number one, another thing is incident reporting. Like I said, day text. How do you report incidents? You have to have an understanding of it. What do you report as incidents? When do you report incidents? You come in contact with a new pressure sore, you have to report it immediately. If you leave it for long or you did not even check that you didn't realize that the patient had come in with a pressure sore, it comes back to you that you are not safe. It comes back to you that you've neglected your patient. It comes back to you that the patient has acquired, pressure sore as a result of your poor practice. You see why day texting is very important, and quickly identifying and putting it into the text, reporting it so that it goes on the record that you have reported it, right? It's a safe practice for nurses. Medication safety. This I can overemphasize. Medication safety. Please, I beg of you, make sure you use your 5 hours, right? The 5 hours, like the right patient, the right route, the right medication, the right timing, the right dosage, right? So you have to. Very important, please. Very, very important. Safety is of utmost importance. And the fourth one, which is promote professionalism and trust. This pillar follows you home. Like literally, it follows you home. Professionalism, right? And trust. Social media behavior. As a nurse, you all know that some things you shouldn't be found doing some things on social media, because you're a professional staff that is looking after patient, that is looking after life, dealing with lives and humans and dignity. So it is very important, to identify things that you shouldn't be taking into the social media space, because they might put you in trouble. Yeah, professional boundaries, very important. The way you relate with your fellow colleagues. You see people, because they're having some sort of unsocial, relationships, they take it and bring it to work. It is not right. It is wrong, right? You can, you must maintain professionalism, even though you have your partner or your spouse in the same ward with you. Professionalism must be maintained. Honesty and integrity, very important. You see, if you make any drug error, human are bound to error. Just inform and escalate it. Let it be known, right? Share it. Report it. That's the word. Report it. Okay. It is better to report and go through the safety measures that you need to put in place. That's for them to get to know about it later. So you have to be safe enough. You have to be honest in your practice, in your care towards your patient, and representing the profession. You have to represent the profession very, very well. So these are the 4 pillars of the NMC Code of Conduct. And how does the NMC protect you? NMC protects you. The code is not just a rule book, like I said, it's your shield. Referencing the code when escalating, using it in your reflection, aligning decision with it. And if your actions align with the code, you are standing on a solid ground. If your action aligns with the code, you are sure standing on a solid ground. So you're backed by the code of conduct of NMC when you practice. So I hope this has really enlightened you. So look out for my next video. I'll be sharing more light. And if you have anything you really want me to talk about, please share with me, and I would, put some more information around it. I'm going to attach a code, a link to where you can read more about the NMC code and also everything that it entails. Thank you, and I will see you again in the next video. Have a nice time. Bye.